Hello, my name is Dr. Gary Bucher, founder and medical director of Anal Dysplasia Clinic Midwest. I'm a board-certified physician and specialize in HPV-related anal disease. Your provider referred you to me today because you are in a high-risk group for anal cancer. And we need to make sure that we're looking for any precancerous lesions so we can treat them and prevent anal cancer. So I want to tell you a little bit about the procedure that we're going to do for that, okay? It's called high-resolution anoscopy. It's just a fancy name for telling us that we're going to be using this scope. It's going to magnify the tissue so we can see everything really easily. But it's a really simple procedure. So when we do the high-resolution anoscopy, you'll be in the exam room. I'm going to have you get undressed. So you're going to leave your shirt and your socks on. Everything else comes off. And you're going to have a seat on the exam table. Then we're going to have you lay flat on your back. Your head will rest here on the pillow and your legs will just dangle. I'm going to check your lymph nodes here in your groin area to make sure we don't have any swollen lymph nodes. After that, I'm going to help you lay on your left side. So it's going to be fetal position. So you're going to kind of lay like this. So you're going to be facing the wall. Your head's going to rest on the pillow. Your bottom's going to be here at the end of the table. Your feet here. Fetal position. I'm going to be taking pictures on my monitor. So when I take pictures, you're going to be facing this way so you can actually see the monitor. So if you want to watch during the exam, I can point things out to you. It's perfectly fine. If you don't want to watch, just don't look at the monitor because you might see some things you don't want to see. So after that, we'll start the exam. We're going to collect a swab for a pap smear and a high-risk HPV test. You've probably already had swabs like that before with gonorrhea and chlamydia testing, so it'll be similar. And then after I collect the swab, I'll put it in a solution, we'll send it to the lab. Then we'll be doing a rectal exam with some numbing gel. So I'll stick my finger in your bottom, we're going to feel around for any lumps or bumps, and if you have a prostate, we'll be checking that also. Then we're going to insert the scope. So the scope goes in about this far. I'm going to take this out, and I'm going to put a little vinegar-soaked piece of gauze through here, and then I take out this anoscope. So that swab's going to be sitting in your bottom for a few minutes. It's going to feel a little odd because you have something sitting in your bottom, but it's really important because it actually makes these precancerous lesions become more visible so I can tell what looks abnormal and what I need to biopsy. And the thing with the vinegar swab is that, and we don't have to go in very far, is because HPV likes skin cells, so the type of skin cells you have on your outside skin. And in your bottom, as your outside skin goes in, it goes in about an inch. It changes over to rectal tissue and then colon tissue. HPV doesn't infect your rectal tissue and it doesn't infect your colon tissue. It really only likes to hang out where those two cell types meet, which is why we only have to go in about an inch. So after 2 minutes, I'll take out that swab, we'll put this scope back in, and then I'll do everything through here. I'm going to add more vinegar and iodine to the Q-tip, and we're going to look all the way around. If I see anything that looks abnormal, we'll do biopsies. Biopsies are really small, they're like sesame seed size. And typically where that outside skin meets this inside skin, there aren't any nerve endings. So you shouldn't feel them. And since they're so small, they bleed really minimally. So after we look at the circumference of on the inside, then we're going to look at your outside skin. Do the same thing. We're going to look for any lesions that need to be biopsied. If I need to biopsy those, we'll inject a little numbing medicine first, and then I'll do the biopsies. And then after that, we'll send everything off to the lab, and we'll get those results back. And if anything comes back as precancerous, then we'll have you come back. We'll get you in the same position like you were, and then we'll find those lesions again, just like we did before. And then I'll inject a little numbing medicine there. So you might feel a little sick, but it shouldn't be bad. And the skin there is very thin, so you can just burn off a small layer of those lesions. And that's it.